Welcome to Roadmap to Residency, Evidence-Based Application. In this video, we will be discussing about screening and preventive medicines. So these are the levels of prevention that we have discussed in our previous videos too. So the primary prevention is an intervention that is implemented before there is evidence of a disease or injury. The secondary prevention is an intervention implemented after a disease has begun but before it is symptomatic. And trust prevention is an intervention implemented after a disease or injury is established. Okay, it generally uh, focuses on the palliative care. Here we have a 25-year-old individual with a family history of diabetes mellitus and obesity presents to a public health clinic for advice on preventing the development of these conditions. The individual has no current symptoms but is concerned about the risk factors. Which of the following strategies represents primary prevention in this scenario? Prescribing medication to control blood glucose level, screening the individual for diabetes and obesity, implementing a regular exercise routine and healthy diet, administering insulin injections to manage blood sugar, educating the individual about the signs and symptoms of diabetes. So implementing a regular exercise routine and healthy diet. So primary prevention aims to prevent the occurrence of disease before it ever occurs. In this scenario, implementing a regular exercise routine and healthy diet represents primary prevention as it addresses modifiable risk factors for diabetes mellitus and obesity. By promoting lifestyle medications such as exercise and diet, individuals can reduce their risk of developing these conditions. Another question. A 55-year-old man with a history of smoking presents to his primary care physician for a routine checkup. He has no symptoms but expresses concern about his risk for developing lung cancer due to his smoking history. Which of the following strategies represents secondary prevention in this scenario? Encouraging the patient to attend smoking cessation classes, performing regular chest X-rays to screen for lung cancer, prescribing medication to manage symptoms of COPD, educating the patient about the harmful effects of smoking on lung health, administering chemotherapy to treat existing lung cancer. So this question is asking us about the strategies of secondary prevention. So performing regular chest X-ray to screen for lung cancer. Secondary prevention aims to detect and treat diseases in its early stages before symptoms become apparent. To prevent progression and complication, in this scenario, performing a regular chest X-ray to screen for lung cancer represents secondary prevention. So, a 65-year-old woman with a history of diabetes mellitus presents to her endocrinologist for a follow-up visit. Despite optimal medical management, she has developed diabetic retinopathy with macular edema, leading to significant visual impairment. Which of the following strategies represents tertiary prevention in this scenario? Initiating insulin therapy to control blood glucose level, performing laser photocoagulation to treat diabetic retinopathy, educating the patient about the importance of blood sugar monitoring, prescribing medication to lower intraocular pressure, or referring the patient to low vision rehabilitation program. So the answer is performing laser photocoagulation to treat diabetic retinopathy. Tertiary prevention aims to minimize the impact of established disease by preventing complication, managing symptoms, and improving quality of life. In this scenario, performing laser photocoagulation to treat diabetic retinopathy represents tertiary prevention. Now let's move towards screening. So what is screening? So screening is the presumptive identification of unrecognized disease or defect by the application of tests, examinations, or other procedures that can be applied rapidly. So what are the different principles of screening? The condition sought to be an important health problem. There should be an accepted treatment for patients with recognized disease. Facilities for diagnosis and treatment should be available for that disease. There should be a recognizable latent or early symptomatic stage for that disease, and there should be a suitable test or examination to identify or diagnose the disease, or the test should be acceptable to the population. Okay, you cannot go on to screen the whole population with some intensive test. You cannot go on collecting the cervical samples or the urethral samples of the whole of the population. The test should be acceptable to the population. The natural history of disease from the latent phase to declared disease should be adequately understood, and there should be an agreed policy on whom to treat as patients. So you need a case definition. a patient definition. The cost of case findings should be economically balanced in relation to possible expenditure on medical care as a whole, which means that the cost of case findings should be, if we screen the population and we find the case earlier and then we treat those patients, the cost to that should be less or economically balanced to that where the patient presents himself or herself to the hospital to get the treatment. The case findings should be a continuing process and once for all activity. So what are the criteria for assessing screening test? So it should be simple, it should be acceptable, it should be accurate, it should be of low cost, it should have a high precision or repeatability, and it should be sensitive. A test should be simple to perform, easy to interpret, and where possible, capable of use by paramedical and other personnel. Since participation is voluntary, a test must be acceptable to those undergoing it. Accuracy. A test must give true measurement of the condition or symptom under investigation. The cost expense of the test must be considered in relation to the patient's, in relation to the benefit of early detection of the disease. The test should give consistent results in repeated trials, and the test should be capable of giving a positive finding when the person being screened has the disease being solved. Now, these concepts are very, very important. Now, this is the first chart. So, how do we evaluate the diagnostic test? So the test that we will be doing should be sensitive as well as specific. So sensitivity means calculating the true positive rate, which is the proportion of all the people with disease who test positive, or the ability of a test to correctly identify those with the disease. Value rate approaching 100% is desirable for ruling out the disease and indicates a low false negative rate. Sensitivity means you want to detect all the person that have the disease, okay, and also you are signing off to accept some of the persons to be falsely positive, but they are not having the disease, okay. So we are calculating the true positive. So here sensitivity calculation is true positive by true positive plus false negative. You need to memorize these formulas. So specificity means calculating the true negative rate, which is the proportion of all people without disease who test negative, or the ability of test to correctly identify those without the disease. Let me explain you here. So in sensitivity, you have seen that a test should be able to accurately diagnose all the people with the disease. So if any test have the sensitivity value at this, then um, it has included all the patients who have the disease, but it has also included all the patients who do not have the disease, or you can see it has included some of the patients who do not have the disease. So this is very sensitive. We are able to at least not miss any case. The formula being true positive by true positive plus false negative. Whereas in specificity, you can see that the our test should be so specific that it rules out the disease in the population. So if the test has the specific value of here, then we can say that the test is not very specific because it is including many patients that do not have the disease, and we want the test to diagnose the patient who do not have the disease. So this is not a very specific test. So this is a sample question. We can pause and carry on itself. Here is another example, but with the answers and explanations. Thank you for watching. Keep studying hard.